Welcome again, everybody, and it's very great for us to welcome you all to this event today. Creative methods in health research, co-producing knowledge with participants. This is the Apply Club Health, and we are a community of people interested in finding solutions to improve health and healthcare by using an applied anthropology perspective. We try to provide an open space to talk, meet, network, and exchange ideas, best practices, resources, and opportunities. You will see a few links in the chat, kindly shared by my teammates, so that you can engage with us on LinkedIn or add your email to our newsletter, so that you can be the first to know about our new events coming up. So today we are really thrilled to have Maaret Jokela-Pansini with us, who will be speaking on this very interesting topic. Maaret will talk about the role of creative methods in health research and how these methods can engage and co-produce knowledge with participants. She will draw from a recent project on people living with long COVID and discussing how their team applied body mapping to understand patients' different experiences and visualizations of the illness. A little bit more about Maaret. Maaret is a senior scientist at the Department of Geography, University of Zurich, and a honorary research fellow at the School of Geography and Environment, University of Oxford. She's interested in experiences of health and well-being related to illness, quality of life, and environmental risks, their impact on people's daily lives, and the ways people respond to such challenges. Drawing on her background in non-governmental organizations, Maaret's research is deeply rooted in community-based methodology, bridging the gap between academia and public engagement, which is exactly the kind of things that we're interested in here. And we really hope that you will enjoy this session. Before we dive in, a couple of housekeeping information. First of all, actually, I wanted to maybe shout out to Heinrich and Margaret, who are fellow organizers in the AC Health. So hi. And second of all, we will record the first part of the meeting. So Maaret's presentation will be recorded. And then we will stop the recording for the second part, which will be discussion-based. The first part will last around 20 to 25 minutes. And after that, we encourage everybody to turn your camera on and ask your questions in the chat, or even better, maybe unmute yourself and ask directly to us and Maaret. And we just have usually a very relaxed environment, and it would be great to just have this kind of spontaneous conversation after the presentation. So I'm just going to pause for a second to see if anybody's got any questions at all. And if not, I'm just going to give the floor to Maaret. Thank you.
Thank you very much, Gaia, for the nice presentation. So I will share my screen.
Perfect.
All right, so I will be talking about creative methods in health research and about co-producing knowledge with participants. In the first part of this webinar, I will talk about creative methods in health research, what are creative methods, why we use creative methods, particularly in health research. Then about co-creating knowledge. In the second part, I will particularly talk about co-creating knowledge with people with long COVID and introduce you to the study that is still ongoing. And before I start, just a bit about my background. Gaia already told you some of the key things. I am a human geographer, and I regularly use creative methods in research and teaching. And in previous and ongoing projects, I have worked with artists, including in a theater, with patients, community organizers, activists, and other communities to study people's experiences of and responses to topics such as environmental pollution or illnesses and the underlying inequalities. During these presentations, I have integrated some pictures from the previous workshops that I have organized in the last couple of years to visualize a bit more this talk. So to the first part, what are creative methods? First of all, when I say creative methods, it's important to explain what I mean by this. So in some contexts, creative methods refer just to the diverse ways that we think about research, data, analysis, and so on. So in creative ways that may deviate from traditional ways of doing research. But here I actually use the word creativity to refer specifically to arts-based methods. And I use the word arts in my own research in a broader sense, so referring to engaging with imagination, creativity, expressing different kinds of knowledges and meanings in different kinds of ways, whether that be visual, verbal, or performing arts. But I also use arts in the sense of art making. So as a human geographer, thinking about the relational spaces where creativity actually takes place and happens. Now, what are examples of creative methods? There are different kinds of creative methods. Body mapping, that I will be talking about today, storytelling, theater, collaborative film, social learning video, photo voice, craft, pottery, creative writing, to name just a few. And even these different methods are being used in so many different ways and contexts. And you can use, and this is really important, you can use creative methods just as an additional technique to support other methods. Like, for example, asking someone to draw, visualize their experiences in an interview, or walk through their experiences with a kind of like a mind map. Or you can take a specifically creative approach and organize creative workshops. And what I would really like to emphasize is that working with creative methods is not only about using photography, drawing, or other methods for data collection, but it's rather that creative methods allow you to think in different ways. So you think through a particular lens about your research, not just in different forms, but different shapes. And I really like how Patricia Levy here puts it. She says that we need to be able to see in different shapes and produce knowledge in different shapes, and hence also co-produce knowledge beyond academic spaces. So what she says that arts-based researchers see and build in different shapes. So using creative method is then more than about collecting data. And I would even argue that in most cases, using these kind of methods is also about being committed to enhancing well-being, at least trying to enhance well-being, which makes it so interesting when doing research around health. So think, for example, about how creative workshops are used to support well-being and health, even in public health contexts like social prescribing. So the different ways that being creative impacts our emotions and well-being. So when using creative methods, we try to focus on meaning and meaning making, co-creating embodied knowledge, as opposed to, for example, viewing just the medicalized body. Creative methods enable also expressing feelings and emotions beyond words, particularly for people who may struggle to express themselves verbally. So if someone is interested in using creative methods, how would you then start? So it is the same idea as in, for example, participatory methods. So thinking about why do we use creative methods? What is the purpose? What is the role of participants? The benefits for them, and so on. So using creative methods, creative approaches, research projects are in most cases also participatory research projects. And as in research, any research project with participants, it's extremely important to reflect on the ethical issues. And I know that most of you are familiar with these questions, but I just want to highlight this. Because if we talk about creative methods as a possible tool to enhance well-being, this is obviously not always the case, as participants may react in different ways. And as with any method, we need to be really careful, prepare the workshops really well. And to do that, it's always good to communicate with the communities we work with. For example, in my case, I have always a co-facilitator from the community I work with, such as a patient organization. And creative methods also, creative methods take time. So we really need to be sure how much, when designing this kind of project, we need to be clear about participants' ability, willingness to dedicate time to this research project. So while organizing a 4-hour workshop for researchers may sound exciting, it is. Many participants, particularly those who have health problems, can't dedicate much time. So these are all things that you, in addition to regular part or different kinds of project, you need to really take into consideration. So now that we have covered what creative methods are and the ethics behind these methods, I would like to present an example of such methods, namely body mapping. And body mapping is about drawing, in most cases, life-size maps of your body, either individually or collectively, and answering questions on the body maps according to guided questions, using colors, images, texts, and other prompts. And Denise Gastaldo and her co-authors describe body mapping as a research method to tell a story about their life experiences that shape how you have become. So what is important is that body mapping is not about taking a snapshot of a particular moment, but describe the trajectory of experiences. And I also really like how McGregor describes body mapping as a museum of one's life. So it records the life story through injuries, scars, birthmarks, illnesses, operations, and so on. And so I added a picture here from one of our long COVID workshops to show how for some participants, body mapping really enables to record this kind of symptoms, scars, marks, and places that hurt. And one of the early applications of body mapping was its use as a community mapping and research tool in the 1990s, 2000 in South Africa to understand people's lived experiences of HIV and AIDS. And body mapping has been used in various fields in social science, medicine, to analyze local understandings of the body, document migration experiences, perceptions of insecurity in urban areas, health concerns, and so forth. And body mapping really lends itself to accessing sensory experiences, embodied and relational experiences. So it draws on emotions and feelings that participants perceive through their bodies. Body mapping allows co-creation of knowledge. It provides a space for collective sharing of experiences. And I added this image here from a public engagement event we did with families to show how body mapping can also be done collectively. So body mapping provides an embodied view for participants to reflect on their health and ill health, their symptoms, but also to reflect on how they feel. And body mapping workshops have different variations, but the ones we have used are structured as follows. First, as with any method, it's advisable to do a test workshop. And in the workshop, you start with introducing the body mapping process and questions, seeking to create a safe space, ask what participants need to feel comfortable. And you can here also add a relaxation exercise if participants want that. Then drawing the outlines of the body in pairs, mapping facilitated through guided questions, either asking one question after the other, or you give all questions at the beginning, then give some time to finish the body maps, sharing of the body maps, reflection, feedback, discussion. And we have also offered follow-up meetings after the workshop in case participants found this useful. And there is, of course, also the possibility, as in any participatory project, to further engage with participants, such as analyzing data and publishing the results. And body mapping workshops can be done from 1-2 hours to several days. And I will now come to the second part, the concrete example of a creative participatory project in which we used body mapping. In our project Visualizing Long COVID with Professor Beth Greenhalgh from the University of Oxford and Una Cousins and Giordano from the charity Long COVID Support, we have explored people's diverse experiences of long COVID and their different needs using body mapping. And this is a strongly participatory research project. People with long COVID were involved in discussing the research questions, recruiting participants, collecting data, analyzing the data, and writing up the findings. So our project seeks to uncover the ways that patients experience their ill health, manage their condition, experience support from health institutions, and how these different experiences vary depending on different social identities. And we also seek to provide a space for people with long COVID to share and discuss their experiences of living with the illness. And long COVID is a chronic illness in which the symptoms of the coronavirus infection continue over long time periods. An estimated 400 million people around the world have or have had long COVID. And the studies have found that long COVID particularly affects women, and women patients' symptoms often being dismissed, attributed to anxiety or psychological origin. So we have particularly focused on women's experiences in the first phase of our project. And our project consists of 3 different phases. The aim of the study was first to understand women's experiences of long COVID. We were particularly interested in the ways they have adjusted to their new way of life and how this has changed the way they view themselves. And in a second project phase, we also developed a body mapping toolkit together with long COVID support, which I will briefly present at the end of this webinar. And in a third and ongoing project phase with Chantal Britt from Long COVID Switzerland, we are particularly looking at access to healthcare services and support in the 2 countries, in the UK and Switzerland, also using body mapping. So our study draws on body mappings and on interviews, and the body mapping workshops in these cases have usually lasted around 2 hours. The materials that we analyzed are body maps, recordings of the discussions during the body mapping workshops, transcripts, and our notes from the workshops and the discussions, as well as follow-up conversations. And the questions in our body mapping workshops centered around participants' health before and after contracting COVID, the impact long COVID has had on their daily lives, support, access to information and health services, and finally, how the participants think that the quality of life of people living with long COVID could be improved. Now, because in this webinar, the idea is to demonstrate what creative methods may offer for researchers beyond, let's say, conventional research methods, I will not present a paper and its results here, but would rather like to focus on some of the topics that emerged. So how can we analyze data in the same way we may think about coding of interviews? And I think these topics show the added value of visualizing these illness experiences. So some of the key themes that emerged from our workshops were around identity, so reflecting on the self before and after long COVID, Some people even drew a before and after body. Language was an important part of the conversations. And finally, the insecurity of present and future. Now, in terms of identity, one participant spoke about how the illness had changed her life. And she says, I'm living in the shadows, obviously, for a long time, even during the main part of the pandemic, and I still consider we're in it. So other people are getting on their lives. I felt a shadow of my former self, and I know a lot of people feel the same, referring to the other long COVID patients. And you can see how in one workshop, two participants here on this picture, two participants shared a picture of a shadow. So they cut an image from a magazine and shared it with each other, which emphasizes this shared experience of the illness. Some participants also said that living in the shadow was easier, as you can see in the quote, in the second quote, because they didn't have to constantly explain their condition to other people. And in terms of language, there were multiple aspects. One participant explained that there's no test, that everything depends on their ability to speak. So the only way you can advocate for yourself is telling people what you have, but you don't have the words. Now, our brains aren't working to find the words. So it hits you 3 times over in that sense. And here in these two pictures, you can see brain fog, which was present in almost all body maps. And there is, in the image above, there is the text, what's the word for? I can't remember, referring to the lack of words due to brain fog. And this statement, not being able to speak, is for many participants also often linked to frustration with healthcare providers and gaslighting, as is also stated in the picture above. And the third and final example that I would like to show here is the insecurity about the immediate and long-term future. One participant described it with not having a floor, a ground to sit down and see where your future is. And she says that she can't make any plans for the present. So you're kind of doing like a triage. And she says that this is what my life was before, this is what my life is now, but my future is a big question mark. And this picture is by another participant who wrote that certain tasks were only possible to do in the mornings and the need to make lists about your day. And now I would like to come back to what I said at the beginning about the potential of creative methods to enhance well-being if handled with care. So together with long COVID support, we observed that many participants really value the workshops and the possibility to reflect on their experiences, not just as research participants. So many participants said that this could be something they could imagine doing at home or collectively and revisit their body maps. So we created, together with long COVID support, a toolkit that you can download from the website that people can use. The toolkit prepares you for the body mapping process, gives also ideas for relaxation exercises to do before and after the workshop, and provides the questions. And there will be actually an official launch at the end of June. If you are interested, you will soon find the details of our on our Visualizing Long COVID website. So to conclude, creative methods such as body mapping enable co-creating knowledge and empower participants by allowing them to visualize their experiences and tell their stories at their own pace and in their own words. So this strengthens a sense of ownership and agency and helps participants feel seen and heard, which is something that many participants felt that they had lack of. Participants provided positive feedback on the process, saying that body mapping is a valuable tool for reflecting on their personal experiences. And the shared experience encourages peer support and helps individuals connect with others who have similar experiences, which can also be very validating. And involving patient support groups in the process enhances the overall impact. Co-creation with patient communities creates also a safe space for sharing, and it reinforces peer support. And what is also very important is that it provides access to information about professional resources. And finally, body maps serve as practical tools for patients to reflect on and communicate their symptoms and lived experiences. Thank you very much for your attention, and I'm looking forward to the discussion.